Spanish flu or influenza, whichever, it really begins in the spring of 1918. And our first identifiable outbreak is at a U.S. military base in Kansas. And soldiers begin to get sick in vast numbers, but others head off to war, crowd the troop ships. And, if we remember the cruise ships that we saw with Corona, a troop ship, you're dealing with several thousand on board living in bunks in tiers of 6 high. So it's pretty crowded. Now, many of those soldiers are sick going on board, and some of them are unloaded in ports in Canada because they're too sick to go overseas. And that will start the disease moving around in Canada. We have another outbreak at a private school, Victoriaville in Quebec. And the school is overwhelmed with all these sick students. And so they're put on trains and sent home. And that's every student, of course, is carrying that disease with them and spreads the virus, and away we go. This is the first wave of the pandemic, and it's compared to the other two that will follow. It's deadly, but not as bad. Now, that first wave in the fall of 1918 will take the virus overseas and begin to spread it through the armies under the ideal conditions of great crowds of people living in close quarters, often in rough conditions, with obviously under great stress too. From the soldiers, it will spread to both sides of the armies and then to the civilian population. Now, due to military secrecy, the deaths are kept under wraps, and none of this is made public. But when it reaches Spain, a neutral country, they report this horrible virus that's killing people, and then it takes on the name the Spanish flu, although Spain, of course, is more of a victim than the instigator or the base of the flu. Now, a second wave will then follow, and this one is much more deadly. And this is where 90% of the deaths will occur, will be in that second wave. Now, anyone who survived the first wave had some degree of immunity to the virus. Now, the numbers are difficult to tally because the disease was often misdiagnosed. Victims were killed by secondary infections. And of course, with medical science, what it was, we didn't even have a microscope that could see the virus, let alone try and cure it. So it spread, and roughly about a third of the world, we figure, was infected. And the death rate is estimated at anywhere from 17 to 50 million worldwide. So for many countries, the death rate will eclipse their battlefield casualties. We're much more prepared today, and a lot of that deals with what is the result of what we learned from 1918. One of the most important developments was the creation of a federal public health department. And we've seen that in action, with Dr. Tam every day in the news, and coordinating through the federal government along with provincial and local health authorities. And so, the actions can then be coordinated and information can be communicated in a much more accurate and coherent way. In 1918, it was really up to local municipalities to decide what to do, whether to quarantine. And, you had some towns passing laws banning or fining people for spitting and coughing. Others, everyone had to wear masks. So today, we're much better organized that way. And it's on an international level as well, with the World Health Organization and the cooperation and sharing of scientific information and developments as well. And we have efforts to work on a vaccine worldwide to provide aid with each other worldwide. So that's a tremendous development. So, our governments are doing their job. And, for all the faults and criticisms people have, they're doing a remarkably terrific job. So we can support our medical and scientific people to help, well, flatten the curve, but also develop a vaccine. But ordinary people have really stepped up. And, if we maintain that, we'll win. Well, again, I want to emphasize, just how terrific ordinary people have come, and despite facing, the fear and enormous grief many have experienced. These crises and challenges often bring out the best in people, not just our political, medical, scientific leadership, but, and ordinary people in our communities really step up. And that's an enormous factor in not only surviving this, but defeating it.